ஆமா.
இவ அவங்க பொம்மை போன் எடுத்துட்டு போயிருவா.
சிறப்பா செய்யறானா நீ
தம்பி மரியாதை பேச சொல்லி கொடு தம்பி.
ஆமா 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 லைவ்ல போகுது. ஓகே 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 நான் மியூட் போட்டுறேன்.
சரி தம்பி. ஓகே தம்பி.
ஓகே ஓகே ஓகே.
Srini, please check with your friend Srini. That's it.
அதை கால் பண்ணிட்டேன் ஜி, அவ எடுக்கல. சொல்லி
அப்படி கோச்சுக்காம ரெஜிஸ்டர் கோட் எடுத்து ஞாபகப்படுத்துறீங்களா 11 மணிக்குன்னு?
அதோ பண்றேன். மா லாகின் பண்ணுமா. ஓகே
தாரிக் உள்ள வாங்க. ப்ரோக்ராம் மனோஜ் சார்
உள்ள வானா ரூம்ல வந்துட்டான் அவன்.
பாருங்க
ஐயா, we are in YouTube live ஐயா.
சொல்லுமா. என்னம்மா? அட்மிட் நான் பண்றேன் அட்மிட் நான். ஹலோ மா, உன் ஆடியோ கிளியரா இல்ல. ஆமா ஹெட்போன் பேசு தப்பு இல்ல, பட் கிளாரிட்டி மட்டும் பாத்துக்க. ஹலோ கிளியரா இருக்கு. இப்போ கிளியரா இருக்கு. உள்ள வந்துட்டியா?
நோ சார் வாட்ஸ்அப் கொஞ்சம் செக் பண்ணுங்க சார்.
ரொம்ப கிளியரா இருக்கு. என்ன பேர்ல உள்ள வந்திருக்க? கொஞ்சம் வெளியே போயிட்டு உன் பேர்ல வாங்க.
என்ன பேர்ல வந்திருக்காங்களா சொல்லுங்க, பாத்துடலாம்.
கார்த்திகேயன். என்ன கேலக்ஸி 9S9 வந்தா எனக்கு கொஞ்சம் ஐடென்டிஃபை பண்றது ஈஸியா இருக்கும், வேற ஒண்ணும் இல்ல. இல்லைன்னா அவன் கார்த்திக் பேர் கூட இல்லையே இதுல. S9+
Good morning, Manoj. Good morning, Srini.
Ma'am, good morning, ma'am.
Thank you, ma'am. All the best.
Thank you so much for joining, ma'am.
Thank you.
சொல்லுமா. நேமோட இருந்தா பெட்டர், டக்குன்னு ஐடென்டிஃபை பண்ணலாம். இல்ல என்ன போன் அது கையில? ஏசூஸா? ஏசூஸ் பேரே இல்லையம்மா இதுல வேற எதுனா பேர் இருக்கா? வீட்டுல வேற என்ன பேர்ல உள்ள வருவீங்க? சரி, நீ வெளியே போயிட்டு வா, பேரு ஜாயின் பண்ணு.
சார் குட் மார்னிங் சார்.
குட் மார்னிங் டாக்டர்.
சார் நம்பர் கொடுக்குறீங்களா சார், நான் பேசவா?
யாருக்கு?
யாரும் கொண்டு வர முடியலன்னு சொன்னீங்களே சார், உள்ள
இல்ல
வர.
அவங்க என்ன நேம்ல வர்றாங்கன்னு தெரியல, அதான் வேற ஒண்ணும் இல்ல.
ஓகே ஓகேங்க சார்.
சரி, அவங்க டாக்டர் பேர் என்ன? அனன்யாவா?
சொல்லுமா. என்ன பேர்ல வந்திருக்கு இப்போ?
ராஜேஷ் வில்லியமா ஸ்ரீனி?
என்னஜி?
ராஜேஷ் வில்லியமா?
இல்லஜி இல்லஜி. போதுமா 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 போதும். ராதா போதுமா, ராதாவே போதுமா, உள்ள வாங்க. பரவாயில்லவா? எப்படி ராதான்னு ஸ்டார்ட் பண்ணா போதும், நான் உள்ள விடுறேன். ம். டேய், நேத்து எப்படி உள்ள வந்த ராதா? நேத்து எதுல வந்த? அப்ப அது பேர் எப்படி மாறுச்சு? ராதான் தான் வந்துச்சு நேத்து. சீக்கிரம், 9 minutes தான் இருக்கு. ம், சொல்லுமா. போதும், அப்படியே உள்ள வா. வா வா வா.
ஓ டபுள் சைடு கொடுத்தாதான் பிரச்சனை இல்லையோ? இல்லைன்னா ஸ்டக் ஆயிடுதா தரையில? ஒன் சைடு கொடு. ஒன் சைடு
சொல்லுமா. ராதான்னு பேரு இங்க இல்லையம்மா. ஒரு நிமிஷம் இரு.
கிளாஸ் 12 ஹியூமனிட்டிஸ் இருக்கு.
யாருமே இல்லம்மா, கோ ஹோஸ்ட் மட்டும் தான் இருக்கோம் நாங்க. நீ வந்து இப்ப நான் கொடுத்த இதுல தானே உள்ள வந்த நீ.
நேத்து
பேரே
உள்ளதுல
இங்க
போயிருக்க போறாங்க சரி அவங்க.
ஆ?
நேத்து உள்ளதுல போறாங்களா இன்னைக்கு உள்ளதுல போறாங்களா?
நேத்து அம்சத்துல போயிட்டு இருக்க நீ. நீ நான் ஒதுக்க போறேன் பாரு. ஏய் நேத்து அம்சத்துல வராதப்பா. உதப்பா உன்ன. அது நேத்து பண்ணுது டெஸ்ட். ஐயோ ராமா, போ போ பின்னாடி போ. அதுல வா. இன்னைக்கு அமிச்சிருக்கு பாரு, அதுல வா. ஹலோ ஹலோ
கணாசன் சார். கணாசன்.
ஹலோ
மனோஜ் சார்.
ஐயா கொஞ்சம்
ராதா
கொஞ்சம் பாத்துருக்காங்க ஞாபகப்படுத்துங்க சார்.
இப்ப அனுப்பியிருக்கேன் பாரு, அதுல வா.
வந்துட்டாங்க.
இப்ப அனுப்பியிருக்கேன் பாரு, அதுல வா.
ராதா வந்துட்டாங்க.
மனோஜ் சார் புரியல என்ன சொன்னீங்க?
கொஞ்சம் ரிஜிஸ்டர் மட்டும் கொஞ்சம் பாத்துங்க யாரும் ஞாபகப்படுத்துங்க.
இப்ப சொல்லிடுறேன் மனோஜ் சார். ஓகே ஓகே சரிங்க மனோஜ்.
நான் இப்ப அட்மிட் கொடுத்தேன் ராதாக்கு.
வந்துட்டியா? வந்துட்ட நீ வந்துட்டல. அனுப்பியிருக்கேன் பாருப்பா, அது விடுமா வா. இப்ப அனுப்பியிருக்கேன் பாருமா, அது மூலியமா உள்ள வாமா. சீக்கிரம் வா.
ஸ்ரீனி சார்.
சொல்லுமா.
சார் அவங்க நம்பர் கொடுக்குறீங்களா சார், நான் பேசவா?
அவங்க கனடால இருக்காங்க.
கால் பண்ண முடியாதாங்க சார்?
நான் பேசிட்டேம்மா, நான் பேசிட்டு தான் இருக்கேன். அவங்க உள்ள வந்துட்டாங்க.
ஓகே ஓகே.
அவங்க வேற ஒரு லிங்க் கன்ஃபியூஸ் ஆயிட்டாங்க.
ஓகே
மனோஜ் சார்
அட்மிட் பண்ணிட்டேன்.
மனோஜ் சார் ரெஜிஸ்டர் சார் மேல மீட்டிங்ல இருக்காங்க.
அப்படியா?
கொஞ்சம் சூரியகலா கிட்ட சொல்றீங்களா? உள்ள ஞாபகப்படுத்த சொல்றீங்களா?
நான் பாக்குறேன் சார். கண்ணா
ராதா உள்ள வந்துட்டாங்க.
ராதா உள்ள நான் கோசம் ஆக்கிறேன் சார் அவங்கள.
ஓகே
மனோஜ் சார் நான் நேர்ல பார்த்து சொல்லிட்டு வந்துருவா.
அந்த ஒரு நிமிஷம் கண்ணா இருக்கேன்.
ஓகே.
Radha ma'am, can you hear us?
Yes, I can hear you.
Okay, fine ma'am. Thank you.
Am I visible and audible? யூ ஆர் விசிபிள். இது மட்டும் கொஞ்சம் கிளியர் பண்ண முடியுமா பாரு. ஜி கிளியரா இருக்கா ஆடியோ?
ஹலோ எப்படி?
கேக்குதுமா, கிளியரா இருக்கு.
கிளியரா இருக்கா இப்ப?
கிளியரா இருக்கு, கிளியரா இருக்கு.
ஓகே.
ஜி ஆடியோ கிளியரா மனோஜ்?
அந்த 1 or 2 minutes இவங்க ஜாயின் பண்ணுவாங்க. மத்தவங்க அட்மிட் பண்ணிடலாமா?
பண்ணிடலாம் ஜி. ஆடியோ ஓகே இல்ல?
ஓகே ஓகே சார்.
ஓகே.
నువ్వేమో అన్ని దగ్గరలో బ్రాంచ్లు వేస్తావు, పెట్టే వాళ్ళేమో పెట్టొద్దు అంటావు. అదేమన్నా
Warm good morning to one and all gathered here. Since our chief guest is about to join, I request your pardon to wait for a few more minutes for our chief guest to be among us. Thank you so much, guys. Register, sir. Am I audible to you, sir?
Hi Manoj, am I audible? Manoj?
All the silence. All the...
Shall I start, sir?
Okay, Manoj. 5 minutes.
Yes, sir.
There, Manoj, okay, Manoj.
A warm good morning to one and all gathered here. We really thank everyone amidst this circumstances you people have joined to gather your knowledge in the enhancement of sports injury management of sports. To start the program, shall we all observe a silent prayer for 1 minute? Thank you so much. May I now request the organizing secretary of this national webinar, Dr. KB Srinivasan, to formally welcome the gathering. Sir, please. Dr. Srinivasan?
Sir, can you hear me?
Yes, sir. Yes.
Yes, sir. So I'd like to thank our respected Vice Chancellor and Registrar for giving us the consent to go ahead with this. And also special thanks to Registrar for accepting our invite and respected lecturers. And last but not least, with whom we are not complete, our students who have been always support and a great support to us in many ways, which is unimaginable. So I take immense pleasure in welcoming you all, and I welcome our chief guest for today, Mrs. Radha Durai Babu, for giving her precious time with us. I have to tell you, she runs 11 and a half hours behind us, so it's almost midnight 11 there. She's from Canada. So it takes immense pleasure to welcome her. Thank you, ma'am, for accepting our invite and taking real pain to come into an awkward time. You still made sure you be on time. So before I get into hand over the session, I wanted to speak a few words about our guest, Radha Durai Babu. She is a registered physical therapist, Canada, business owner, Alberta Padmini Physical Therapy Limited, and she's a certified MET Level 1 trainer and a certified intramuscular stimulator acupuncture, Canada, and she's a certified Shoha therapist and a K laser from United States. Not only that, she apps the topic of first aid because she was the former honorary secretary for St. John Ambulance Association, Coimbatore, and she has been awarded twice Governor Award for maximum number of life member in Tamil Nadu state in 2007 and training maximum number of candidate for first aid in the year of 2009. So with this, I thank all the authorities for helping us to go ahead with this and welcome everybody once all. Thank you all. Sir, session to you, sir. Manoj, sir.
Thank you, Dr. Srinivasan, for welcoming you all. Today's chief guest and our university authority, who is a man of perfection by himself, a man of knowledge, a man of discipline, a great visionary who guides us in each and every corner in the field of academics as well as administration. It is none other than our registrar, Dr. V. Gopinath. He was a former professor, a great human mankind who has got a lot of helping tendency to support each and every one of our university in growing in the right path along with our Honorable Vice Chancellor. So may I now invite our revered registrar, sir, to deliver inaugural address. Sir, please.
Thank you, Manoj, for the good word in the morning you are given to me. Honorable Vice Chancellor of this Tamil Nadu Physical and Sports University, officers, syndicate members, HODs, faculty members, organizing secretary, participants, and resource person, Dr. Radha Durai Babu from Canada. Very good morning to one and all. So I'm very happy to be associated with this national webinar on sports first aid and injury rehabilitation. It's a wonderful title, have been taken as well as the, going to be implemented in the hours to come. I hope this webinar will be a most useful one to all the participants as well as the event experts, because one of the experts is participating and acting as a resource person for this program. On behalf of the university, I will record my sincere thanks to Radha Durai Babu being a resource person and accepting the offer of the university. Now, let me come to this main area of the sports first aid. So being a past sportsman, not now. Now I am a good spectator. After heavy injuries in sports, I understand how important this is. Yes, we know as a physical educator, on field and off field, first we know, but we are very poor in injury rehabilitation. Because of that, I couldn't able to continue my sports. Personally, I feel I am failed in my career. Though I am teaching this area, I am personally failed that rehabilitation part, and I keep on with the injury. I keep on playing and keep on doing my activities that aggravated, and that should not be. A sports person or a person having a passionate to sport must have good fitness. If injuries comes, you should rehabilitate and recondition this. Then only can go for the further program or further competition level. But we are doing so many research on it. But we are, as far Indian scenario is concerned, we are very poor in implementing the research finding as well as the theories are known to factor even, because always we want to go for better level, next level of tournament, keep on going tournament. We never give the space for the rehabilitation and training part. So I hope the organizing secretary have taken a good title to be discussed in this morning, and I thank personally Mr. Manoj as well as being with you in this morning. I pray Almighty to bless everyone, and this webinar will be a successful one. Thank you. Thank you, Manoj. Thank you, Anandal. I congratulate Radha Durai Babu for her acceptance.
Thank you so much, sir, for your golden words of appreciation to us. Let me now hand over the session to the international expert in the field of first aid and sports injury rehabilitation, Dr. Radha Durai Babu. Ma'am, please.
So, Manoj, I have walked. I'm waiting. Very good morning, Radha. So I'm
very good morning,
I'm
sir.
leaving.
It's
I have
nice,
some official work. I'm
to-
leaving. Have a nice time. Thank you.
Oh, thank you so much, sir.
Thank you.
Thank you, sir.
Yes, ma'am. Yes, ma'am. Please.
It's a great pleasure to be here at this moment. And I will thank all the team members who organized this. Srinivas, Manoj, Mr. Manoj, and Dr. Gopinath, and all the team members taking personal efforts in organizing this. So I really am. I'm really proud to be here at this moment. So, any questions so far? Shall we go ahead with the session? Can you just share the slide? Can you just share the slide, please?
Yes, ma'am. Can you have your volume a little bit higher, ma'am, so that it was not audible to some participants?
Sure. Am I audible right now?
Yes, ma'am. Yes,
ma'am. Perfect. Srinivas, can you, is it okay for you to share the screen, please?
Srini, sir.
Okay. So this session is sports injury and rehabilitation. Dr. Gopinath had a great input that his rehabilitation part was not up to the point where it should be, and then he was not able to get into the field that has further written to work. So this session, I would be focusing more on a holistic approach. Emergency can arise in any place. It's not just a sport alone. It might happen in your workplace. It might happen at home or in outside when you do some recreational activities and sports activities. So it's going to be the holistic approach of this session. If you have any questions or concerns, please do type in the chat box and just feel free to discuss at any point of time. So first I'm going to go ahead and discuss. Next slide, please. Next slide, please. So I'll be discussing on what is first aid by itself, an environmental emergency, medical emergency, and trauma emergency. When it comes to trauma, we'll be talking more specifically about sports-related injuries and its rehabilitation. I will definitely touch base on that. And finally, I will be there to address your questions. So coming to first aid, next slide, please. First aid, when we say first aid, what comes to your mind? It is just a skill that is temporarily assisted at the time of emergency. So the emergency, as I told, it can be any type of injury. So you can break a bone or any bites and stings, or it can be any hot objects that's falling on you. It can be of any sort. So in that scenario, what I am going to do, with the materials available there, before you get into the out of the healthcare professionals, what you're going to do to your client at that point of time, with the materials available there, that is all a first aid is about. So on field, you would have all the first aid equipment. How many of us carry a first aid kit at home, to be honest? You can type in the chat column. Do we literally carry a first aid kit in our home? Really not, right? So you should definitely have some emergency things in your home. Just simple. You can have an ice pack. You can have your bandages. That's sort of that kind. So this is the skill that you're going to do with the materials available there, and you're going to help your client. Next slide, please. So this is what I was talking about. This is all is about the stage. Pertaining to the sports, how fast and how quickly you react to the injuries. If a sports person gets injured on field, if you don't give an appropriate first aid care on field, his rehabilitation would be affected, which would again affect his return to work and return to his normal functional activities. So this is where the whole chain lies. So addressing the concern right away is crucial and it's vital. Next slide, please. So I'll come to snake bites. I guess your campus is a big campus, eh? And you have, I guess you have lots of trees and plants around, and you never know what is inside. If what happens if a snake bites? It will not happen on field, definitely for sure, but as we go to the field on the way or whatever. In that scenario, what I'm going to do? Next slide, please. It all snake poisonous. If you guys can type in the chat column, I would really appreciate that. Just feel free to type. Yes, perfect. I just have one answer there, no. All snakes are not poisonous, that is for sure. Next slide, please. So then why people die of snake bites? What do you think? Why people die when they have snake bites?
The anxiety would kill them. So that anxiety where we play a major role, you need to reassure, not all the snakes are not poisonous. It's just few snakes that are poisonous. Can you just, next slide, please? Next slide, please. So you can just see a few snakes there, cobra, rattlesnake. These are neurotoxic. When I say neurotoxic, what does it mean to us? What do you mean by neuro? Does all the snake poison travel through blood? You would have seen in movies, people cut open and they give a big tourniquet, they suck the blood out. Does this all going to help you? Not really. Because, first of all, not all snakes are not poisonous. Just few snakes are poisonous, and out of which the poison travels through different sources in our body. They travel through nerves, they travel through blood vessels. So there is no point in cutting and sucking and doing all the sort of stuff. So when I say neurotoxic, it travels through the nerves. So the sea snake, all these things are neurotoxic. Next slide, please. Next slide, please. So you can just see the hemotoxic. When I say hemotoxic, they travel through blood. So vipers. So these are few snakes in which this poison travels through blood. Even in this scenario, we are not supposed to do the cutting and opening and making a tourniquet, all those stuff. So what can be done and what has to be done? Can you just change the slide, please? Next slide, please. So your safety comes first. Make sure that you don't get injured in that scenario. You're going to make yourself safe and you call for the help. So the emergency service in India is 108. In other countries, you have 911. Please do call them as soon as possible. Reassure the client. Please tell them, be calm, nothing would happen. Do not give them any constrictive bandages or shoes or remove their watches and rings, anything that is really tight. Please remove all those stuff and immobilize the extremity. So this is what we are all trying to talk about, what has to be done and what should not be done. So you're going to just do not move the part, ask for the medical attention. So you're going to apply some splints of that sort. Next slide, please. Do not engage in any strenuous physical activity. Do not cut. Do not suck. Oral suctioning, no. Don't give them any medication because we are not healthcare professionals to give medication. Do not apply any ice or cold pack. Do not do any constrictive tourniquet. Don't do all these things. So this would really save their life. Next, dog bites. Next slide, please. Yes. Anybody has any questions? Please do type in the chat column. Yes, Chaudhry. Do you have any questions?
Participant cannot unmute now. So you please go ahead. We will have the discussion session at the last, ma'am. By summarizing all the questions, we can discuss.
Okay, perfect. Coming to dog bites, safety, call the EMS again. So dog bite is the very worst. So, you know, there are stray dogs and few are homegrown and they are vaccinated, and which is good. However, when you find dogs, stray dogs, you never know what how they are vaccinated or what's going on. It's very important that these people would not develop any symptoms right away. They'll just have the bite mark. If you just take it casually and if you just let it go, it would show its effect after many years. You guys are aware, I guess it's rabies, where they would be literally, to be honest, they are highly infectious. They would not, they're even it's like your pandemic. You are not supposed to touch them, you're not supposed to give them touch their utilities, or do not touch their plates or food, whatever they're having. So that worse is rabies. So when there is a dog bite, or you need to right away get vaccinated, even just if there is a small sting or even just a small bit of bleeding from there. Sometimes people do take it casually, but no. Please visit your doctor. They would prescribe you. There are a certain set of drugs and dosages how you have to get vaccinated. That is very important. So in case of dog bite, reassure them, wash the area completely with the water and apply bandage if there is bleeding. And do not do anything right away. They have to take into the hospital and get vaccinated. This is the best choice. Medical emergencies. So now we are going to jump into our stream. Heart attacks. So you would have heard of people saying he was walking normally, he just went on a walk, he just fell down and he passed away. Because the worst thing is sometimes you never know the pre-existing condition, what the person is having. So you physically just see them and observe them. He's healthy, he's doing his activities of daily living, he just goes for a walk and suddenly he passes away, or he gets a chest pain or heart attack. So how do you determine whether it is a heart attack or it's just an indigestion problem? Sometimes there is a lot of controversies in this. So they just think that it is just indigestion. The classic symptom of an heart attack, or if they have chest pain, they would have nausea. It would be like a very excruciating pain. In a scale of 10, I would say 8 or 9. That worse it would be. Of course, it would be radiating to your left side of your body, to your jaws and the mid back. In that, how you have to address this can arise even in the sports field or at home, or if when you go on any outdoors, if you hear from your relatives, all those things, it's better to call the EMS right away. Certain clients, they would know that they have some issues going on with their heart. So if they have issues going with their heart, they would have the medication on them always. How do you get to know? If they are able to talk to them. Do you take any medication which you put under your tongue? You can ask them directly if they are able to talk. If they don't have medication, do not give them anything. Just make them lie in a half lying or any comfortable position. Half lying is the best position, I would say. That would half lying in the sense you give them 2 or 3 pillows, make them lie down in such a way that they are able to relax and call the emergency right away. Because most of the heart attack, what happens is they go into some rhythms or ECG or something, and which has to be addressed right away by the EMS. So they go and give them CPR. So CPR itself is a separate entity where you have to be trained to perform CPR, which we call it as cardiopulmonary resuscitation, if you have heard of. So this is what would happen if needed, as needed, I would say. It's not that all the clients need CPR. No, there are certain criterions who might need it. So what you can do the best, position the client, give them the medication if they take it, or else you don't give any medication, call for help, and CPR as needed if you're certified and trained to do so. Then coming to seizures. Have you heard of seizures? Do you know what seizures is? We call it in a layman term fits, right? So when I say fits, what happens? So it's an abnormal electrical activity. Something is going on in the brain. There are many causes for fits. So imagine if they have an whole history of seizures, they may get at any point of time. If they are playing on field and they have a seizure attack, how do you address it? Please make sure the area is safe. If it is a field, just make sure the surrounding area doesn't have any pebbles or stones or something of that sort that they might injure, especially their head. So if it is a ground, give them a small roll towel under the head so that they don't bleed. Turn their face to one side because they might vomit sometimes. So we don't want them to get aspirated. When I say aspiration, nothing. It's just you have 2 pipes in your throat. Okay, we call it as a foot pipe and a windpipe. So whatever has to go in your foot pipe will incorrectly enter into the windpipe, and you have all the things going into your lungs. We don't want that to happen. That's why you turn the face to one side. Don't give them any sharp object. There are some myths where they give you iron and something of that sort. Please do not do that. Do not restrain your client. When I say restrain, do not hold them tight, because seizure activity would last just for a couple of seconds 2 minutes. If it is worse, if it is lasting more, it is dangerous. They have to be taken to the hospital right away. So do not restrain them. Next slide, please, KB. So the client would recover within a couple of minutes. Once they recover, they will be really tired, very tired. So you have to put them in a recovery position. When I say recovery position, it is a side lying position. Just turn them to one side. That is more important. So once they recover, then they have to go to the physician to get it checked and addressed. So what you can do not hold them tight. Don't give any objects in their hand. Put a small roll float under the head. Turn the face to one side. This is what you're going to do. Normally in other countries, what they do is if they have even diabetes, they would wear a bracelet. There are different scenarios in other parts of the world. So when you don't know what's going on, it's better to get checked from their physician once they recover. Next slide, please. Trauma emergencies. When I say trauma, here comes sports. So on field, the client may have, so very sport specific, I'm not going to go ahead and talk. You're all physical educators, yoga teachers, and we have physical therapists. So when you encounter a scenario while you're treating a client, or when you are when you're on field as a physical therapist, or when you're on field as a physical educator with your group of clients. So imagine if they just twist and turn and roll their ankle and they come with big swelling, bruising, and bleeding. What do you do? So when the bleeding, our blood has a tendency to clot by itself. It will just take a couple of minutes. But when there is an injury to a bigger blood vessel, imagine if it is coming from a very large blood vessel, then it is not possible to stop right away. But if it is just a bruising, you can see in the picture, in the ankle, you can just see a little bit of bruising. This kind of injuries, definitely our body is so well equipped to heal by itself. God has created, Mother Nature has created us in such a way that we can heal. It just takes its time frame. So small little wounds, yes. But when you see those penetrating wounds or incised wound, that is serious, right? So in a field, you would not encounter this, but you might encounter bruising, you might encounter small cuts. So in this case, the concept is very similar and very basic, just direct pressure. You put a clean cloth, apply direct pressure, and elevate the part. The bleeding would stop. If it is not stopping, and if it is continuously bleeding for, say, longer period of time, definitely you need to go to a doctor. So these are the types of wounds which might happen at your field. There are two types of bleeding. You can just see in the picture, internal bleeding and external bleeding. When I say internal, by the word it implies internal, it's inside. So for internal bleeding, you cannot do much. That is a long-standing case, but you can see bruises. If it is an ankle injury, say a soccer player, they roll their ankle. Sometimes you might see those red areas around their ankle. It would just heal by itself. But in this picture, if you see, there is a big internal bleeding, which has to be taken to the doctor. External bleeding, a small cut in the thumb, yes. I would just go with direct pressure and elevation. So this is what, next slide, please. Methods to control bleeding. You're going to apply a direct pressure. Make sure that your safety is important. Make sure you wear a gloves. If you have a first aid kit, definitely it would have a gloves. In nowadays, we live in a pandemic world. So I guess all of you guys, you will be having a glove, mask, and whatnot at home. Hey, even as a, I would say, even some do carry pulse oximeter. So people are well trained and well educated, and they are more knowledgeable now. So just apply direct pressure, elevation, and tourniquet. I would say do not. It's a gray line. So when I say gray line, it is either yes, no, nor no. Because if you apply a tight tourniquet, it is dangerous. It would hamper your circulation. So it's a gray line. Pressure points. There are some pressure points in our body, but you should be well equipped to know those pressure points, to apply pressure on those points to control the bleeding. So I would rather prefer the first two, compression, direct pressure and elevation. This would help. Next slide, please. Coming to fractures. So I would give a question. I would recommend all of you, if you can just type. They will take the same soccer player who rolled his ankle on the field. He comes with a big swelling. His pain scale is, say, he's saying severe pain, which is not bearable. And he is not able to walk at all. What would you think of? Will you think it's just an ankle sprain, or is it a fracture? If you can just type in the chat column. Satya, yes, perfect. Dave, yes. Can you just justify why? Just 4 screening questionnaire. If you ask these 4 questionnaire, there are possibilities of fracture. So yes, they do have pain, lot of pain. Yes, I strongly agree with that. Disability for walking, yes. Swelling, yes. Swelling and pain. In ligament injury, it can be managed, Deva. Okay. Swelling. Both. Jacob. Perfect. If it is a fracture, 4 screening questionnaire. Just remember, client has severe pain. So severe excruciating pain, unable to take weight. They will never put weight on that feet. They will not be able to continue the game they are playing. They cannot walk out of the ground. They would need a help. They would limp, they would hop. Not able to take even 4 steps. This indicates there are possibilities of fracture. In a ligament injury, if it is, there are different grades. I don't want to go in depth. If it is a ligament sprain, they would be able to take weight, but it is bearable. If it is again very worst, the joint itself will become unstable. But this forced screening questionnaire, if you are sure about, very excruciating pain, not able to take weight, cannot walk out of the field, and he's hopping. Not even 4 steps they're able to walk. So there are possibilities of fracture. I would not say definitely it's fracture because you never know what is happening inside. It is all just from the subjective, you just ask them, right? So there are possibilities. So they need to be addressed right away. So they need to undergo investigative procedures, of course, x-rays and stuff like that. They won't accept to touch the site of fracture. Yes, Rakesh, yes. So there are 2 types of fractures, open and closed. So closed fracture is something that is broken. You can see in the picture that it's your backbone. It is broken, and it is just there. And the other one, you can see the bone is exposed outside. So by the term, it goes open and closed. So if it is a closed fracture, what I'm going to do? If it is an open fracture with all these wounds and bleeding, what I'm going to do at the site? So these are the symptoms. Next slide, please. Signs and symptoms of fracture. So as you guys told, pain, swelling, there might be change in the shape. They will not be able to move the part. I did give the example of a soccer player. Next slide, please. Management of fractures. Immobilization. How I'm going to immobilize. Bandaging and splinting. Just do not move the part. Every bone in our body has a tendency to heal by itself. It's nature's gift. But the way that it heals is more important. That is where a healthcare professional and physical therapist play a very important role. It is when as a physical therapy educator or physical educators and yoga teachers, if you encounter this, what you guys can do is you can just immobilize the part. Do not move it. So what should I do? If it is something related to shoulder, if they're wearing a shirt, just take 2 buttons off and give them an arm sling. Put the 3rd button on the 1st button. That would become their arm sling if it is a male client. If it is a female client, if they are in an Indian scenario, they would be wearing a sari or a dupatta would work. If it is a lower extremity, you need to tie both the legs together and just move them using a stretcher if possible. So this is how you immobilize them, and they need to undergo further investigation. Whiplash injuries. Have you heard of this whiplash injury? Do you know what is the term whip means? What it is, Muthukumar? What is whip? Have you heard of in Tamil they'll tell sata, right? For the cow and stuff, they use it the whip. That is called as a whip. So whiplash injury pertaining to the sports, I would say rugby, kabaddi, falls, heavy sports activities, all these things, and of course driving injuries. This picture shows a driving injury. Your neck goes back and forth like a whip. ஒரு சாட்டை மாதிரி முன்னாடி போயிட்டு பின்னாடி வருது உங்க கழுத்து. If that happens, what is going to happen to my neck? What is going to happen to my brain? So what would happen is brain would encounter a scenario where the brain would shift from its place. It would go and hit front in the skull and back. We call this as, in other words, they call it as concussion too. If somebody hits, even you tend to bang your head against the wall, or when you get up, sometimes you hit your head up. All these things are concussion. Whiplash injury, when the high impact, this is high impact, sudden break. If you're driving a car, or even in a town bus, you're traveling in a local public transport, and if there is a sudden break, what do? You jerk forward and come backwards, right? That's what is happening. So in that scenario, you might injure your brain cells. So what can I do as an educator, or when they encounter in a rugby, it's a rough game. Kabaddi is a rough game. They would tackle you. If they come with severe neck pain, only few questions you can ask them if they have severe neck or back injuries. Just ask them if they have dizziness. Are they nauseating? Are they able to see well? Are they able to swallow? Just 5 questions. If this is all is not there at that point, they are good. However, I would say concussion, they would develop symptom after even 7 days or 10 days, but it has a capacity to heal. So make sure your client is safe to go back to the field to play again. If they determine subjectively, they say no, please do not force them, because they need that healing time frame to recoup again, to play, to prepare themselves. Body, listen to your body. That is the word I would say. Just listen to your body. Next slide, please. Okay, before going into burns, I would like to add a few more inputs on whiplash injury. If it is a spinal cord injury, again, spinal cord injury, there are possibilities in this type of injuries too. Those clients, the very big mistake, what should not be done is handling them inappropriately, pulling them out of the vehicle. So what happens is, imagine a pen. Inside a pen, you have the, what do you call it, as a refill, right? So the refill is your spinal cord. The pen is the bone covering it. So the bone is broken. And if you are moving here and there, the broken bone might go and pierce your refill, right? The same thing would happen to your spinal cord. If that happens, if the spinal cord is being injured, if they are pulling them out of the vehicle in an incorrect, inappropriate way, they would become paralyzed. If it is going to happen to your neck, both limbs, both legs gone. So we don't want that. So we have to transfer those clients. If they have a fall, rough game, ask them if they have severe pain in the neck, not able to move, something is locking there, please refer them to a doctor. It is not under our care. It's beyond our scope. So that has to be addressed by a physician as soon as possible. They have to be taken by a special equipment. They give them that big collar. If you have seen, I guess you might be knowing, they give them a collar, and they would take them in a stretcher way. They don't move them at all, especially their neck. That important it is. Are we good so far? Any questions? I would be answering all the questions once I am done. Coming to burns, there are different types of burns in a sports setting. Definitely, as I told in the beginning of the session, I'm just going in a holistic approach. You might encounter this at any places, especially in this world. In our back home, I would say it's less likely, but here we live in an wooden house, so we are more, it's all more secure and protected, especially for fire. So when it comes to fire, there are different types of burns. Flame burns, by the word it implies flame is, you can just see it's because of something getting burned. Electrical burns, you get electrocuted from the electricity. Chemical burns, when they are exposed to harsh chemicals, those are chemical burns. If it is a flame burn, you would have watched in movies what they do, they put a big blanket and roll them, right? Which is right. Yes. You can first call for safety and emergency, which your safety is more important. In burns, if you are a rescuer, sometimes what happens is you would become a victim. There are I have seen in my college days in KMCH many clients who were a rescuer and their hands got burnt. So your safety is very important. Hold the blanket against you so that they don't come and hug you and you don't become a victim. So your safety is very important. Call the emergency, put off the fire. So you roll them in the blanket and roll them in the ground. As soon as possible, these clients, they would swell up immediately, swelling. And there are many other complications associated with that. If they are wearing jewelry, especially rings, please do remove it, because if they have a big swelling, it would cause a tourniquet effect, and that would hamper their circulation and resulting in further complication. So if they have sticking clothes in their body, please do not try to take it out. Do not put any lotions, ointments, all those of that sort, no. Because it's very hard for a physician to remove those lotions, or there are many stigma where people do all those things. To remove that would take longer time. So please don't do all those. If you're able to handle it, if you're in a safer position, please roll them off. Yes, you can put water, lukewarm water, if available, whatever water is available. Yes. People may ask, it might cause blisters. Never mind. Blisters is just a second degree burns. So it is important and it's crucial to get the flame down, because if the percentage of burns, if you have heard in hospital, people would say these many % they got burnt. If the percentage goes higher, their survival rate is going to become lower and they're more prone for complications. So versus getting a boil, second degree burn, which is definitely going to heal. So yes, you can definitely put water, lukewarm water. And next slide, please. Chemical burns. Chemical burns, your safety is important, of course. Call the EMS. Just wash the part in a running water, cool running water for 20 minutes or so. Do not put, again, the instructions remains the same. Do not put any lotions or ointments causing further damage. Just wash it with running water and take them to emerge. This is all we can do at that point of time. Coming to electrical burns. Electrical burns, first and foremost, your safety. I guess you guys might be knowing, do not touch the client because you might get electrocuted. So call for EMS if you can turn off the main supply, yes. And the very worst thing here is these clients would go for arrest immediately, cardiac arrest, because there is a big mismatch of the electrical current and our heart. So the heart would go for a fibrillation, we call it as in medical terms. So that means that the electricity is too much that the heart cannot cope up. So we do cardiopulmonary resuscitation as needed when they are out of the main supply. Again, CPR, if you are certified to do so, yes, or just call EMS and they would handle it in a better way. Next slide, please. I'm open for questions, and I would definitely go through the chat column and I would answer the questions. And further questions pertaining to any specific injuries or which you would like to address, I would be there to answer it, definitely, for sure.
Thank you, ma'am. I have just summarized some of the questions that have been asked in the chat box before. Question number 1 is from Pavitran. If a dog bites me for more than one time, what should I do?
Address it to the physician. So that is not under our scope. So it's the physician who would determine what has to be done. Yeah.
So second question is from Nelson. What are the precautionary measures to be taken in sports activities during COVID-19?
Very good question. Social distancing, mask. See, they say all these strategies, I guess you are all really aware of. Face shield, and you have the goggles, everything, all the protective gears, PPE. That is for sure. Again, COVID, it's a big pandemic that's going on. Even big researchers and scientists, they're not aware. Whatever updates I know, I can just tell you. Initially, they said it was airborne. Then they came up with a droplet. So pertaining to field-specific training, if it is an open area, it's better than closed indoors, because here the encountered scenario here is we work more on indoors. It's a heavy winter here right now, so the chances of spreading the infection is more. Even high level of training, it happens is indoor, but you're in a better position. In our back home, you train in outdoors, so definitely the chances of getting it is less likely. However, you need to take the protective gears for sure. Did I answer your question?
Yes, ma'am. Yes, ma'am. Thank you, ma'am. My next question is diagnosis and management of rib fracture in contact sports from Girish Raj.
Perfect. Rib fracture, there are two things you need to address. Just splinting. Do not do anything. The way it is broken, it might be broken and it might puncture your lung, or it may poke out. Two things might happen. So do not do anything. Just splint the area. Take a towel, or I would say a pillow, a soft pillow. Just support that part, tight around, not too loose, not too tight. It's up to the patient comfort, and you have to take them to emerge, and they have to undergo an X-ray, and the physician would determine what to do. There are different types of fractures. Fracture, the bones get broken and then it would move away from its place, or it will just stay there. So the physician would determine if it is just going to stay there, he might as well leave for it to heal. The bone has a healing tendency of 3 months to 6 months. So it depends on the area of the bone which is injured. So as a physical therapist or a physical educator, what we can do is just split the area and take them to the doctor.
Thank you, ma'am. Next question is from Meenakshi. First aid for hypovolemic shock.
Okay, so hypovolemic shock is all your fluid is drained out. So that is hypovolemia, right? So all your volume is gone down. We cannot do first aid. Do not give them anything from your scope. They would be taken to the hospital and they would be hydrated because it's a fluid loss, right? So we cannot, under the scope of first aid, hypovolemia doesn't fall under our scope.
Next question is from again Pavitran. What are the reasons behind knee injury? What immediately has to be done for it?
Okay, so the potential knee injuries I would categorize in with regards to the sports. There are many conditions which we can list, but emerge, I would say, patellar dislocation, that is your kneecap dislocation. And there are possibility of soft tissues, that is your meniscus, ACL, PCL, your hamstring pull. All these things are soft tissue injuries. In an emergency point of view, if it is a dislocated kneecap, if it is going to pop out, if the client is able to tolerate it, if he's going to relocate it, he can, but you don't try to relocate it. Take him to the physician, because the worst thing with kneecap dislocation is it is a recurrent injury. Once they had it, they would have it again and again. So a physical therapist plays a vital role. So you need to brace it, tape it. Of course, if that happens, your RISE principle remains the same. Taping and appropriate sport-specific rehabilitation and education of the client. So you have to tell them, so what not to do, what has to be done, or strengthening of the muscles, appropriate strengthening, flexibility. And in order to prevent redislocation or recurrent dislocation, to be more specific from physical therapy point of view, train the muscle on the inner aspect of your thigh, that is your VMO. So VMO strengthening, when it comes to VMO strengthening, you train the last 15 degrees of knee extension. And IT band, your IT band would be tight, stretching of IT band. Again, the set of protocol remains the same. The terrain, the shoes, everything has to be taken care of. And when it comes to meniscus or your ACL injuries, if it is a meniscus, worst thing where they cannot play again is if the knee is going to get locked. If the knee is not going to get locked, if they are able to bear the pain, give them ice pack. If they are able to, if the pain levels are less, they can go back to playing. It depends on the degree of tear. Of course, the ACL, again, the scenario remains the same. Hamstring pull, yes. So it depends on the degree of pull. So everything has a set of protocol. In emergency point of view, patellar dislocation, and if the knee is just getting locked in certain position, they have to be taken out of the field. And of course, your fracture, which we already discussed.
Thank you, ma'am. Next is kindly explain the first aid for head injury due to hard ball in cricket from our university professor, Dr. Tirumala Kumar.
Can you come again with the question, sir?
Kindly explain first aid for head.
Okay. Head injury,
Yes, ma'am.
concussion.
Yes,
So
ma'am.
the 5 screening questions, I would say we put it in a very simple terms: 5 Ds, 3 Ns, 1 A. These are the screening questions. When I say 5 Ds, dyspnea, if they have dizziness, difficulty in swallowing, changes in the vision, if they're not able to see, if they see everything double. So these are red flag screening. That means something is wrong with their brain, for sure. So double vision, difficulty in swallowing, all these things, yes. 2N, changes in the nystagmus, we call it as in other words. So the dancing of the eyeball. And nausea. Nausea is vomiting. The before you have the sensation, right? 1A is ataxia. When I say ataxia, they're wobbly. They cannot walk. These are the screening questions which determines there is possibility, I would not say definite, possibility of head injury. So again, it's under the care of the physician. If they don't have all these things, they have mild symptoms, we put them under concussion. They have dizziness and they have a little bit of pain, stiffness in the neck. If they're able to continue the game, yes. If it is an open injury, bleeding from the head, so what we can do is you can just cover the area, take them to the physician. If it is bleeding, literally nosebleed, ear bleeds, yes.
Thank you, ma'am. Next question is, if the snake bite happens in the upper part of the body, can it be tied or not with a rope?
Can it be tied?
Or not with a rope?
No, that is what we call it as tourniquet, right? So I told you, tourniquet is making tight knots, that's the myth that is going on. They cut open, they suck the blood out, they make a tight bandage. They think that the poison will not travel up. That is a myth. Mudanambike. So that should not be done for sure.
Okay, ma'am. Immediate first aid care for a person who has drowned.
Drowning. So
Yeah.
drowning, the drowning clients, rescuing them again, if you're well enough equipped to rescue them, they just pull them out of their well or whatever. So the way they hit the head also matters. They say that they pull with the head, but I would not recommend that, because if they are going to, if the well is not deep enough, if it is very shallow and if they have a head injury and if you're going to pull with the hair, no. If you're going to lift them higher up, saving the head and neck is more crucial. If you're able to get them out, getting the water out is important. So you just give a gentle compression, you take the water out, call for EMS, call for help, and CPR as needed.
Thank you, ma'am. Management of hiccups in heart patients.
Sorry, sir, I cannot hear you.
How to manage hiccups in heart patients.
Hiccups in heart patients.
Yeah.
One moment. I don't know, for some reason my video.
You are on, ma'am. You are on.
I'm on? Okay. Okay. Hiccups in heart attack. Hiccups, just I'll ask you, is hiccups more important? Because there is again a myth, whatever happens with the water, okay? If they even choke, you give them water. Heart attack versus hiccups. Hiccups is just a contraction of a diaphragm. Diaphragm is that muscle below your lungs. So that is going to go for full contraction, which can be managed. That is not the priority. Heart attack is the priority. So don't give them water, nothing of that sort, because they might, the possibility of aspiration. This is what I was talking, even seizures, I told you, don't give them and turn the face to one side. The biggest thing what the people do is, water happens, they give them water. When they give them water for an unconscious or semi-conscious client, the water will go into the windpipe and go into your lungs, which will cause pneumonia. So hiccups is not a priority. Don't give them water. Heart attack is the priority.
Yes, ma'am. If we do have a cut injury in the neck area in the on-field, how to stop bleeding if it involves major vessels like carotid artery?
It's less threatening. It is less threatening. So it's an EMS. It's just a matter of seconds. If that is going to happen, that is worse. It's less threatening. Carotid artery, it's kind of done. So on field, what you can do is just apply some pressure and right away to doctor. It's crucial. It's very important. Like they will not last long. The concept remains the same. Direct pressure, again I told you, if it is a very major blood vessel, the bleeding will not stop. Even if you apply direct pressure, carotid artery will not stop. They would end up again in further complications.
Thanks, ma'am. What is the management of on-field management of heat illness or heat stroke?
Heat stroke, hydration, hydrate them appropriately, take them off field. Heat stroke is give them ample amount of water and recoup them. Once they are feeling comfortable, they can go back to playing. Hydration.
So in this when a player dashes against another player, it results in an unconscious state of a player.
Sorry, excuse me, Manoj, I cannot hear you for some reason. Can you be allowed, please?
In the game like Kabaddi, if one player one of our university professors is willing to ask question, ma'am. Grace, ma'am.
Yeah.
Can you ask, ma'am?
Yes. A very good afternoon to all of you, and congratulations to Dr. Radha for your wonderful presentation today. And congratulations to Master Manoj and Mr. Srinivasan for organizing this wonderful session. And once again, I congratulate you, Dr. Radha. And it was a wonderful session to hear from you, all the injuries you have covered. And especially you started with the snake bite and dog bite and so on and so forth. And I would like to ask some clarification and your comment on this, right? Especially regarding the snake bite, the most death occurs in India regarding the snake bite, right? And what is the reason behind it? And rather than snake bite, the mosquito kills the most human. All right. So what will be your comment to improve whether the pest control is not happening in India or what else could be done? at present. Hello, can you
I,
hear me?
I would
Yeah.
say, yes, I can hear you, ma'am. Thank
Yeah.
you for the question.
Yeah.
So with regards to the snake bite, yes, it's the lack of education, I would say, education in the sense knowledge about the condition itself. So the myth and anxiety kills the person. So if it's just that it's a mindset that they have an assumption that every snake is poisonous, and once it is done, they are going to something is going to happen. Then that puts them in a very devastating situation. So that is the one. That's the reason behind it. And if you logically think, if there's a snake bite, if it's a neurotoxic or hemotoxic, nothing to do with the myth of cutting, sucking, and stuff like that, or a thorn cut. So that has to be taken, that myth, how we can do that, I would definitely address it. So I have like, today we have 600 participants. Everybody has a family. Talk to your family members. Tell them what you learned. Educate them. If you have grandparents, they have been living there for years, and which is inculcated in our culture. So tell them this is the fact versus myth. And with regards to mosquito, I have no comments on that, but I'm sorry about that. So it's how we keep our environment neat and clean. So that is a very important thing. So self-discipline, I would say. Just we should be good enough to treat our surroundings and our neighborhood. Yeah.
Thank you, Dr. Radha. Thank you, Dr. Manoj and Srini for the opportunity.
Thank you so much, ma'am. I think the chat box has been filled with lots of questions further. We will try to collect all those questions and put forth to the expert and get the answers and get back to you in the WhatsApp group. Now it's time to formally propose vote of thanks. Let me first thank God Almighty for giving us the enough amount of strength to organize this national webinar with an international expert. Next, I would like to thank our Honorable Vice Chancellor, who has been the backbone of our university, who has been giving all sort of support for us to engage in these type of webinar and other sport promoting activities from our university end. I would also like to thank our today's chief guest, Dr. V. Gobinath, our university registrar, for the opening remarks that he has made at the start of this webinar. I would also like to thank all the professors, associate professors, assistant professors, supportive staff, and non-teaching staff of our university who has been helping us, our department, as well as our university in the promotion of sports. I would like to place my sincere, heartfelt thanks to the international expert, Dr. Radha Durai Babu ma'am, for her support. So when we contacted her, without any hesitation, she obliged the offer, and she has been presented a very good presentation, which is very common for all sports fraternity, including physical education people, coaches, trainers, fitness experts, yogic peoples, and the other medical professionals who have also joined with us. So we are soon going to come up with another webinar, which will cover most of the needs of sports medicine fraternity in a very short span of time. Please wait for our further share of invitation over to that. I would also like to thank my own brothers, Dr. K.B. Srinivasan, the other organizing secretary of this event, Dr. K. Kannadasan, Dr. Rajini Kumar, Dr. P.K. Sendil Kumar, Dr. Manoj Kumar, and Dr. Uma Diliraj for their support in organizing this Zoom webinar through technical support. I would also like to thank all the participants who have trusted us to being a part of this national webinar. Finally, I thank one and all. A last announcement for the participants. For the first 100 person who are going to fill up the feedback link, will get your certificates immediately. Post 100, you will be having your certificates in both Gmail as well as your WhatsApp group. So please stay in the WhatsApp group till you get your webinar certificate. Please do stay in the WhatsApp group, and you will also get a Google Drive link in your Gmail or whatever mail that you have been given in the registration form. It will be very shortly being delivered to you within a span of 1 to 2 days. Please be stay with us. So this act of saying thanks is not just words, it is from our heart. Thank you so much, everyone. Thank you so much.
I would like to thank everybody in organizing this webinar. It's a new broad platform. Thank you one and all, the University Chancellor and the team members, my lovable students. I have great passion towards teaching. Despite all my circumstances, I made it work. Thank you so much. Thanks, everybody.
Thank you, ma'am. So
Thank you.
the feedback link will be shared with you in the chat box of Zoom, in the chat box of YouTube, as well as in your WhatsApp groups. So thank you so much, everyone. So now I'm going to end the meeting. Thank you, one and all.